individualization of the treatment is of great importance, huge relevance. So first of all, we have to discuss with the patient if he suffers from his disease, if he is symptomatic. And symptoms must not only mean sleepiness, as we know from obstructive sleep apnea. Patients with heart failure, for example, often do not claim about sleepiness because they have other problems like fatigue, like disturbed sleep. They do not sleep so well for long periods of time. But they have accepted it because they say, I'm sick from heart failure, so it's normal for me. So your first step is to see if the patient suffers from symptoms, sleepiness, fatigue, non-restoring sleep, recurrent cardiac decompensations, recurrent atrial fibrillation. So this would be an indication for treatment. And then you have to select the right treatment for the patient. We must not promise longer survival. The data do not show so far that we can improve survival. In general, there might be in specific cases, but we cannot promise it to the patients. But when we start treatment because of the symptomatic indication, we start with CPAP because it's the easiest treatment. It's also a cheap treatment as compared to other options. But if it doesn't work and the patient is still symptomatic, then we switch over to adaptive ventilation, and we can discuss in the future oxygen, pharmacological agents, phrenic nerve stimulation, based on the decision of the patient and based on the availability in his or her country. So for example, adaptive ventilation is not available in all countries, or phrenic nerve stimulation may only be offered in very few centers. So this is something which we have to take into account, and we have to discuss with the patient what is feasible for him. Some patients cannot accept wearing a mask. Others do not want to use a drug for a long period of time. So this means individualization of treatment.